Hi, I'm Stephen Jones. At Robert Wood Johnson, we believe citizens need to be informed about the important healthcare issues affecting their lives. That's why we're proud to support the healthcare programming produced by the Caucus Educational Corporation.
Humanism in Medicine, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by the Russell Berry Foundation, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Fedway Associates, Inc., Roche, Horizon Blue Cross Blue Shield of New Jersey, making healthcare work. New Jersey Natural Gas, proud to support education in our communities. Berkeley College, and by Wells Fargo.
Welcome to Caucus. I'm Steve Adabato. You know, caring and empathetic doctors are absolutely crucial to the healing process. Joining us here in the studio to discuss the importance of humanism in medicine are Dr. Richard Levin, President and Chief Executive Officer of the Arnold P. Gold Foundation, Dr. Leah Kaltman, who is a general internist at the Summit Medical Group, LeAnne Robert, who is a medical student at New Jersey Medical School, and finally, Dr. Ravi Munver, Vice Chairman of Urology at Hackensack University Medical Center. Dr. Kaltman, I got that right, did I not?
Yes, you did.
Clarify that. Let's do this. Throughout this program, you'll see a website, several websites up there. Pursue the information, not just ours, but connected websites. Find out about humanism in medicine. By the way, I always say fully disclose. I'm going to disclose this. We are huge fans of Arnold P. Gold. Dr. Gold, not this studio, but a couple studios ago, we sat down with him. And when this foundation was started, when he and Sandra started this foundation, it blew us away that, first of all, there wasn't anything like it, and that he was leading this effort to change the dynamics, the doctor-patient communication, the relationship. What is the foundation for those who don't know it, and why is Arnold Gold a giant in this field?
Well, Arnold and Sandra founded this in 1988, as you know, and he is a world-famous pediatric neurologist at Columbia Presbyterian. And he began to notice that the trainees who he was responsible for, and residents and his faculty, were beginning to be seduced by the rise of technology and forgetting about the connections which are so critical to delivering optimal health care.
The human connection.
The human connections.
Between doctors and patients.
Yes, and now we'd have to say between all healthcare providers and patients.
And so, by that includes nurses, and who play such an incredibly important role. We have an affiliation with the New Jersey Nurses Association. We're constantly trying to talk about the role of nurses in this process. So the foundation does a lot of important work in this regard. It's tried to change the way medical schools teach about the way patients and doctors interact, correct?
Yes.
Talk about that.
I've been with the medical schools working as a preceptor for a number of years.
For those who don't know the term, preceptor.
A preceptor is someone who volunteers to have medical students shadow them during certain office hours, and the students are able to improve and just really practice watching somebody as a clinician. And it's now started in the first year of medical school, where I have students rotating 1 week. It's actually a course of several months, and I think it just really helps enhance compassion, allows them to learn communicative skills. It's all changed. I mean, you know, years ago, students weren't exposed until their 3rd or 4th year of clerkships.
It changes the entire dynamic. You know, I'm going to give you an interesting setup, and you'll jump in here. I do a communication seminar in a lot of corporate and educational situations outside of my work in broadcasting, and I show a scene from Patch Adams, and I know you all know the scene. There's a scene in Patch Adams where Robin Williams, fake doctor, you know, and fake medical school student, I think, as well. He's not even really a medical school student. So he's in there, and they're going on rounds. And rounds are, describe rounds? Rounds, what are rounds?
Well, it's when you take usually students or residents to see patients and communicate with them.
There are 10, 15 residents. They're going through.
Sure.
You know the scene?
I don't know the scene because I've actually never seen Patch Adams, I hate to admit.
Well, you'll recognize this.
Okay.
Maybe not today.
Okay.
But you know the scene I'm talking about? They're going through, and the chief doctor, the big boss, right? He's walking them through, and they come up against this woman. You know the scene? And there she is, and she's laying there, and they say, and he says, here we have a patient, and look at her, and her leg is all ripped up, and he said, we have such and such neuropathy, blah, 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 we may have to amputate. Any questions? And any osteomyelitis, any this, that, and they're asking all these clinical questions, right? And finally he says, any other questions? And there's Patch Adams, right? Robin Williams, he turns and he says, what's her name? The doctor says, what? He said, what's her name? And the doctor looks at the chart and he says, Marjorie. And he looks at her and he says, hi, Marjorie, how you doing? She looks at Patch Adams, played by Robin Williams, and she said, hi. The entire dynamic changed. I know that's only a piece of it, and I belabored the point of this scene, but I thought to myself, and Patch Adams is part of this humanism medicine movement, you know what I'm talking about?
I get what you're talking about, but I haven't seen the movie. But I think that when you add the humanistic component with your patients, it changes the relationship and the way that you're actually viewing your patient. And you're taking away that aspect of only looking at the patient from the point of their disease or their condition, and actually as a human. And I think that's an important teaching point for medical students and residents and attendings.
But you know, devil's advocate, even though I asked Arnold this question 100 times, and Sandra as well, medicine's not personal. You can't get that personally involved. Right, doctor?
Well, I think that's what people think of about surgeons, and I happen to be a surgeon. And I really don't agree with that statement, because I think if you're not involved, it takes that certain aspect away from the care that you deliver for that patient.
But it was important to know Marjorie's name. It was important to make that connection, right?
Yeah, because the problem, easy to fall into, is thinking that you are treating a disease rather than a patient who has a disease.
She was like a piece of meat just
She was a
sitting there.
disease. And that causes all manner of difficulty.
Not only, forget about just her name, but here's what I kept thinking as Arnold Gold started talking about humanism and medicine 15, 20 years ago with us, that the more you know about Marjorie, and I'm only using Marjorie as a metaphor for something much larger, as the more you know about that patient, the more he or she begins to trust you and begin to believe that you actually care about her, about Marjorie the person. Isn't she more inclined to share more with you? And are you then not more prepared to what?
You know, I think in every specialty of medicine, compassion does build trust and confidence. And it's a matter of a doctor unraveling, taking the time, acknowledging symptoms, but unraveling beneath what a patient may physically show outward signs of. The time that it takes to really understand and sense, have that sensitivity and sense what may be emotionally affecting them as well, really is a quality which we need to integrate and maintain with all the sophistication of technological advances. And you know, it's a challenge. But I think with patients, they do look to that, have a partnership with a doctor, not for us to be too authoritative, but for still, you know, for us to be still professionally responsible.
Now, you told our producers that you have some rules about the way you communicate with your patients. First of all, is it true that you actually physically, doctor, get down to their level?
Absolutely.
What does that mean?
You know, it's the first 15 seconds of an interaction with the patient can make or break that encounter. So
how so?
When you walk into a patient's room or walk into an office setting, shake the patient's hand, acknowledge their name, look directly at them, eye to eye, And don't look over the patient. Don't have the patient sitting on an exam table while you're standing up. Sit down. Be at their level. Be at their level both emotionally and physically. And I think that makes the relationship off to a good start.
But you also said some other things. You talked about the importance of not interrupting. Well, play devil's advocate again. With all the pressures you have, you're running a business. I'm sorry to offend any physicians out there. You're running a business, right? Was that a terrible thing to say?
No.
No,
not at all.
I think a lot of people do view medicine as a business.
But I didn't even mean that as a negative. I'm meaning you are running an operation, a team, okay?
Sure.
You're moving, there are patients in the waiting room. If you could spend as much time as you wanted with a patient, you know.
But humanism has to be woven into the reality of
Play
running
that
a
out.
business.
Talk about that, because doctor doesn't interrupt. He wants people to tell their story. He wants to take time, but you have people in the waiting room. What do you build in?
You build in the extra time. One of the things that we must defend is the doctor's time with the patient. So as insurance companies, the federal government, whomever is screaming for more efficiency,
Yes.
there needs to be a stop beyond which we cannot go, because it's the next question you ask that's going to reveal the secret in the history that will allow you to make the diagnosis.
Explain that. The next question, what do you mean?
You've been with the patient for 2 minutes.
Yep.
The average doctor only lets a patient speak for 18 seconds before they're interrupted.
Sorry for interrupting you as we're talking about interrupting. Go back again.
Yes. The average doctor interrupts the patient in the telling of her history after 18 seconds of conversation.
Because?
Because the way we have been trained and the pressures that you've just described of being under intense pressure to speed things up result in that interruption very rapidly. Thought process is, after 18 seconds, you've heard enough of that introductory commentary, and then you can hone in on what you think is going on.
And you're saying that there's a very good chance that the next question, and more importantly, the next answer, may be a part of that conversation where critically important information is revealed that helps you make a diagnosis.
Yes.
And ultimately care for that patient in a way that is significantly different.
Yes.
Am I making too much of this?
No.
No.
And you're thinking what right now?
Well, I think that even not just coming up with a diagnosis, but just determining if your patient is compliant with medication. Let's say a patient comes into your office and you've been trying to treat their blood pressure for months, and their blood pressure's
issue, right?
Yes.
Okay.
And you've noticed their blood pressure has not gone down the entire time that you've been treating them. But every time they're coming in, you're chastising them for not taking their medication. But if you don't let them tell their story, you may not know that maybe them getting their medication means a $2.50 bus ride in Newark to go get their medication, and then paying for their medication when they may have to take care of their children or their mother or whatever other economic things that they have to worry about. But you may not ever get that out of them if all you're doing is pointing the finger and doing the talking and not letting them tell their story.
Now, this is fascinating on so many levels, because it isn't just talking about having a tremendous impact on the culture of the world of physicians, right? Because that's the Arnold P. Gold Foundation has been trying to change the culture of physicians for a long time.
Started with physicians.
Right?
Yes.
But we're also talking about changing the culture of patients who look to physicians to play this godlike role, if you will. I'll shut up and you tell me what to do and I'll do it. And this doesn't sound like that.
Yeah, I think formally patients really were more accepting of trusting a doctor's clinical judgment. But
Today?
No, I think previously.
What about
I think
today?
now with the internet available, patients coming in sometimes self-diagnosing themselves. It's a difficult situation because the role of the patient is now they might be more, it's very helpful for them to be more informed, yet at the same time, we have to still work together and remember that the clinical judgment of the doctor also has to still be, have a strong impact on which way we go to manage patients. And
who's the quarterback?
I think it works both ways.
Who's the quarterback? There can only be one quarterback in a medical case.
The doctor.
Not the patient.
That's a tough question because the quarterback might be the patient who's leading the doctor into making the final outcome of the whole, the whole story.
Is the answer it depends here? Because
I think it does.
Because it depends upon the patient.
It changes.
Yeah, but have you found, doctor, that patients who tend to be older, I don't want to generalize and be unfair here, but that older patients tend to want to engage less in this back and forth and are looking for you more to be the quarterback, take the ball and control the process?
For me, I don't really see that that's...
You don't see that?
I don't see that it's really age dependent. I think it depends on the individual patient. But, to what Leah was saying, I really think it's the patient who's the quarterback, at least for me. Many patients come to me with a diagnosis.
Give us an example.
They're coming for surgeries. A patient comes in, their internist diagnosed them with a mass on their kidney, a tumor, a cancerous tumor. The patient comes in, they're coming in for an operation. They already know, they've done the research, they know what needs to happen, but they're here to engage in a dialogue about how it's going to happen, what to expect, what are their chances of cure.
But wait a minute, they're also coming in with tremendous anxiety and fear and confusion and misinformation. And by the way, isn't it also important that a lot of times the patient come in with someone else in this process?
Sure.
Right?
Yes.
Right.
When they're, no?
Yeah, and we have to go back even further, and we have to talk about education K through 12 in the United States, and whether there is a place in the curriculum to teach the role of the patient. Make sure that every citizen has a voice in this circumstance when he or she becomes a patient, because 21st century healthcare is largely going to be team care, and many people believe that the patient will be the captain of that team in most circumstances.
And so let me ask you, in terms of humanism in medicine, you are saying that for all the years that when we started doing this with Dr. Gold, much of the conversation was about physicians and changing the physician culture and medical schools and curriculum. You're saying that the way this conversation around humanism in medicine has morphed, evolved, it's much more engaged around a discussion of the role of patients, right?
Absolutely.
Schools, other players in this. It's not all, you can't just put this on doctors.
No, it's the entire healthcare team. The Robert Wood Johnson Foundation, not far from here, has a program which they've begun called Open Notes.
Yeah, I've heard about this.
You know about this?
Yes.
It's the idea that the health record belongs to the patient. The patient ought to be able to see it and to modify it in real time.
Right.
And so far, the experience with this has been extraordinary, because both the patients and the physicians involved in this both want to continue.
By the way, when you log on to our website, not just that website team, but put up our website and then link it to the Robert Wood Johnson Foundation. They happen to be one of our underwriters for some other programming, and I know that they have that program called Open Notes. It's important because in terms of being an advocate for yourself, you need to know what this program is, because those notes are yours about your medical records. We have 5 minutes left. I've been thinking about another piece of this whole equation, humanism in medicine. As technology continues to advance, and very quickly, and Isn't it hard for people who are constantly going on the internet and thinking, hey, I'm keeping up with things. I'm getting all this new information, and that's my job, is to constantly get out there and do that. Can't patients also get confused out there on the internet, right?
Yeah. If you take a patient who, let's say, has had diabetes for a very long time, they may know a lot about their illness, and they may be very educated about what diabetes means to them. But the vast breadth and the scope of diabetes and its impact on other systems in your body, they may not have that understanding because they haven't had that training. But I think the information that is available electronically and that patients can get a hold of is, in a sense, empowering to that patient and allows us to, and we need to utilize it more to allow patients to be really involved in their team decision and how their health care should be delivered.
I was thinking one of the things that physicians can do is also help patients navigate the internet and help them understand how to use it more effectively. One of the other things I was thinking is that we keep talking about what humanism in medicine does for patients and improved outcomes, improved relationship between physicians and patients. What does it do for physicians? Humanism in medicine done well. It's not an incident. It's not an event. It's part of your DNA. It's part of your life, your approach, your philosophy. What does it do for you?
Well,
what has it done for you?
Exactly. So humanism in medicine, I mean, I don't really consider it in medicine. I think it's humanism in general. We take what we do at work, we bring it to our friends, we bring it to our families,
How?
we bring it outside. Because it's a way of life. This is the way.
Give me an example.
This
Make
is the
it
way.
real.
Okay.
Bring it down to a real level.
Okay. So, you know, we're talking about empathy, compassion. All right, empathy and compassion. You should be empathetic towards everyone, towards my children, towards my friends. You should be compassionate. You should be respectful.
And that's humanism in medicine.
I believe respect is one of the real key elements
I hear
of humanism.
You. Here's the thing. I kept asking myself, A, can you teach this, right? Empathy and compassion. Obviously, some people are more inclined than others. It's more natural for them. Others, I think it's very hard. Others are on the fence and they may be more teachable. You hug, though.
I do.
No one taught you to do that. You just do this.
I often, for patients, I walk into a room and I say hello. You know, I've known them. I give them a hug. Patients sometimes are tearful in the office for not even a reason that they came in for the office visit, but it is something that I just feel that I want to embrace somebody. You know, let them know that I hear your pain, and just comfort them into letting them know that it will be okay. You know, sometimes patients need that, a tight hug, you know, tissues, a follow-up phone call to many of my patients.
What does that do?
It just makes me feel like I care, and I think they get the message that, you know, I'm thinking about you. It's just very important to build that connection with patients. I see a lot of my patients not just as a patient. They're an individual. It's just part of, you know, working with somebody, and it's touching to see how they're affected as well.
How rewarding is your work?
I love what I do. It's very rewarding to me. There's, you know, I think all of us here feel that way.
1 minute left. She's the poster person, but here's the thing. Is humanism medicine, does it work because of people like this? And/or you've got to get other people who may not be naturally so inclined to understand it and live it, both? Because there's not that many. Frankly, there aren't. I'm sorry for embarrassing you. There aren't that many people who are naturally like the two of you.
Well, these three are exemplars, but the approach is that everyone should have this. And I'll tell you that it's the rare medical student who enters medical school without these characteristics,
Really?
these traits. It
So medical
absolutely
schools are
is.
looking for
They are
it.
needing, they are looking for this in their admissions process, these certain personality traits and qualities in the process.
Well, let's do this. We have a few seconds left. First, I want to thank all of you for joining us.
Thank you.
You are a credit to the profession. You're going to be great at this. And most importantly, I have a feeling Dr. Arnold P. Gold will be very proud of all of you, and I think all of us. Thank you very much.
Thank you.
Thanks for watching. Now let's continue the conversation about this and other important topics and issues on Facebook. Visit my page at facebook.com/Steve Adabato Ph.D.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. And 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Russell Berry Foundation, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Fedway Associates, Inc., Roche, Horizon Blue Cross Blue Shield of New Jersey, making healthcare work. New Jersey Natural Gas, proud to support education in our communities. Berkeley College, and by Wells Fargo. Promotional support provided by NJ Biz, All Business, All New Jersey, The Star Ledger, and NJ.com, Everything Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios. Brought to you by the Healthcare Foundation of New Jersey.
Did you know, under the Affordable Care Act, all new insurance plans must cover preventative services for women? That includes contraception, well woman exams, and breast cancer screenings. To learn more, information about healthcare services is available at the New Jersey Citizen Action Helpline, 1-888-654-3893.